When I came to Congress to work for the people of Virginia's 2nd District, I knew there were many issues covering a range of topics I wanted to solve. What I did not expect was the sheer number of VA-related issues. Since beginning my first term nearly 2 years ago, these issues are the most common complaints people call my office about. And through my work as chairwoman of the Oversight Subcommittee, I see why. As chairwoman, I have unfortunately discovered many cases of poor leadership, gross mismanagement, and substandard medical care at VA facilities. Sadly, this includes my veteran community's local facility, the Hampton VA Medical Center. In March 2024, my district office in Virginia Beach began to hear concerning reports from whistleblowers about the Hampton VA, particularly the facility's leadership and surgical services department. Whistleblowers described the facility as a repository for well-founded patient safety issues and hostile work environment complaints. Whistleblowers also alleged physicians who spoke out on behalf of veterans and quality care were retaliated against. After hearing this, I immediately began investigating these shocking allegations. Since then, my team has talked with numerous whistleblowers to fully understand Hampton VA's many issues. Through this work, I repeatedly heard reports of patient safety concerns, ineffective facility leadership, internal employee disputes, and dirty surgical operating rooms. For example, I heard reports that clinical staff were forced to clean surgical rooms themselves if they want to treat their patients in a sanitary environment. I also heard facility leadership consistently failed to address patient care concerns. And as a nurse practitioner, these allegations were very appalling. Whistleblowers reported how instead of investigating the patient care concerns that were brought forward, VA leadership would retaliate against those who reported the concerns. Whistleblowers allege that because of this environment, the Hampton VA has a critically low number of clinical staff. For example, the Hampton VA has only one full-time anesthesiologist. This significantly limits the number of surgeries at the facility, which forces patients needing emergency care to be transferred to other facilities. As a nurse practitioner, I know moving patients around in this fashion raises the risk of complications and harm, and this is unacceptable. The VA Office of Inspector General has released several reports on the Hampton VA which confirm the facility had serious issues. I was alarmed when Inspector General Massal told the committee during a hearing earlier in the month that Hampton VA leadership did not follow basic processes and that VISN-6 did not even know there were issues with the Hampton VA leadership. Such lack of oversight is especially alarming given the OIG has published multiple reports beginning in 2022 detailing Hampton VA's leadership failures. As such, VISN leaders should have been aware there were problems at the Hampton that needed fixing. Moving forward, VISN and Hampton VA leaders must regain veteran trust. Now, I'm aware Hampton VA has new leadership, and I'm optimistic that if these new leaders fully implement the OIG's many recommendations and if VISN-6 properly conducts oversight, the Hampton VA can move in the right direction. I will continue to work with the VA to make sure this happens. House Republicans have continued to put the VA's feet to the fire to fix these problems at VA facilities nationwide. These leadership changes were desperately needed at Hampton, and they were exactly what we are talking about when we tell the Biden-Harris administration that concrete actions need to be taken on behalf of veterans and their families. I look forward to speaking with our witnesses today to learn more about what the Hampton VA and VISN-6 leaders are doing to address the OIG's recommendations and whistleblowers' concerns.